Hi, Lynn. How are you?
Hello, I'm fine. Thank you for having me.
I am honored to have you. It's very interesting when someone has a podcast like yourself and books. It's like I feel like I know you, but I really just am meeting you.
Yes, we are just meeting each other. Well, when somebody comes up to me and says, "Oh, I listened to the podcast," I say, "Oh, then you know a lot about me because we
Right,
talk about a lot of stuff."
exactly.
Yep.
Exactly. But one of the reasons I'm really excited to do this with you is when I listen to your podcast, Flusterclux, which I just love the name. It's
Thanks.
the perfect name because it's exactly what we feel as parents, right?
Yeah.
And your books, The Anxiety Audit and Anxious Kids, Anxious Parents, and just so much of what you've written and your work. One of the things that stood out to me was that you've been doing this for 30 years.
Well, I say 30 years. This is my 34th year
Okay,
as a
this is my
therapist.
34th year.
No kidding.
That's what I was
Yeah.
saying. Like I was listening to you and just, I got caught up in the podcast because I'm, referencing you, and I feel that parenting is so much a part of my work, treating selective mutism
Mhm.
and working with parents. It's 90+%. The younger they are, it's even almost 99%, right?
Yes. Yes.
And teaching them the skills. And as kids get older, it's obviously a little less, but it's still so critical.
Mhm.
And so for me, parenting is what it's about.
Yep, same. And you may have had the same reaction that I do, but and I say this very openly if you've listened to me, anybody's listened to me, is that it really sort of astounds me how in this field that we're in, how many people work with little kids and the parents are not included at all.
Exactly. And that was what I was so attracted to in your work, is that you're like me, parent. It's about the parents, and it's a
Mhm.
touchy subject, right?
Mhm. Mhm. Yeah, and I think that it's a matter of talking about it. I do a lot of speaking, and so parents come up to me after talks and they say, "Well, my 7-year-old is in therapy or my 8-year-old or sometimes my 5-year-old." And I say, "Well, what are you working on?" And they go, "Oh, well, we're not allowed to go into the therapy room." And I'm just like, "Well, this 6-year-old can't be in charge of their anxiety disorder, right? I mean, we can't say to a first grader, 'Okay, look, here's what we're going to do.'" Okay? Yeah.
Exactly.
Yeah.
Exactly. And so for us, like we do Communicamp, it's the intensive group treatment parent
Mhm.
training program.
Mhm. Right.
Kids are in the program, parents are in the program all day, parent education and support.
Yep.
And that's such a big part of it. It's not like you said, the kids are going to walk into their teacher and go, listen, I'm feeling anxious. I
Right.
need you to do 1, 2, 3, and 4. And so it's about setting up the world, right, for these
Mhm.
kids
Yep.
in the school, the teachers, and parents. But I really want to talk about parent anxiety today. And it's a
Okay.
really, I mentioned about a touchy subject because parents get defensive. They get guilty. They feel guilty.
Mhm.
They feel like, what did I do to create this?
Mhm.
Right. So we're not trying, obviously, to shame anyone in this. But the
Mhm.
truth is, apples don't fall far from the tree.
Right.
And you talk a lot about it.
Yeah, and we are social creatures. So the
Yep.
way that I say to parents, look, if your child is bilingual because in your home you speak English and Portuguese, the reason that they speak English and Portuguese is because you speak English and Portuguese. And
Exactly.
so the language of emotional management, the language of how you perceive the world, the language of how you celebrate holidays, the language of, the how you fold your laundry, how you load the dishwasher, how you hold your fork, all of those things are taught. And so there's no reason to think that suddenly we're going to not have that influence when we're talking about emotional management, when we're talking about stepping into the world, when we're talking about what you're supposed to be afraid of and what you're not supposed to be afraid of. Because we are social creatures, that's just the way it is. And there's no shame, there's no blame. That's just a fact.
Absolutely. And as you know, selective mutism, people focus on kids not speaking, but selective mutism is a social communication anxiety
Mm-hmm.
disorder. And that's
Mm-hmm.
honestly the basis for my work and my research. And that there's a very strong percentage, over 39% of families, when we did a family history study, have anxiety, the genetic component. But as you talk about, there's the genetics, and they present with a very social anxiety, generalized anxiety, mainly
Mm-hmm.
social anxiety presentation. But then there's the ones that don't have that. So the anxiety is stemming from other reasons, the whys, as I call of SM. But I want to talk to you about that kind of genetic, that they've inherited it, but they've also learned it, as you say, generational anxiety, right? And their own experiences that have kind of curbed their way.
Yeah. So we know that there's, when we're talking about anxiety, we know that there's a genetic push because we know that temperament has a lot to do with this. And I often say that, as we all know, if you've been hanging out with human beings for a while, some kids come out like chihuahuas and some kids come out like golden retrievers, right? I mean, it's just different. And when we've got this combination of nature and nurture, so if you have a temperament, that means that it's harder for you to be in the world, you're not as extroverted, it's really hard for you to model that for your kids. There's really good research. There was one great study that looked at teenagers with anxiety. And what it showed in the study, and it said, and I quote, no significant evidence of genetic transmission, but hugely based on modeling, right? So that's one study. There's great work done by this woman named Golda Ginsburg,
Yes,
where she looked at families where one or two of the parents were anxious. The kids were not yet showing indications of anxiety, but we could predict because that's the way the statistics go. So she did some preventative work with these parents. And she said, so here are the things that we know become risk factors. The way you talk about your own fears, whether or not you promote flexibility or rigidity in your family, all of these risk factors. And when she gave the parents the information about this, when the kids came back a year later, 0% of these kids had developed anxiety over that year. So there are concrete things that parents, like I say to parents all the time, I'm not blaming you. I feel like this is enormously useful information that I want parents to have because we want to think preventatively. We in the United States are not so great at prevention. I don't know. People will say, we should treat mental health like physical health. And I'm like, really? That's going to be the model? Because we're not so great at prevention with physical health either. But parents, I feel like we have to empower parents, just like you do in your trainings, because parents say, I'm sure they say to me all the time, just tell us what to do.
absolutely.
Just tell us what to do. We need to know the do's and the don'ts. You understand this. They say, you get this, you deal with this. Tell us what to do. And I think that's incredibly helpful for parents.
No, for sure. It absolutely is. And the other thing that you get is the parents that, go to their therapist and they will sit in the wait room on their phones and hope the therapist, the doctor, will cure their child. And let's talk about that because it's not going to happen without their involvement and their training and their willingness to be vulnerable and open.
Right. So the way we want to talk to parents about it and what I want parents to understand is that we're just trying to interrupt these patterns.
Exactly.
And if parents don't know what the patterns are, how are they going to interrupt them?
Right.
It's funny because, and I'm a huge fan, a huge proponent, a huge creator of homework between sessions, right?
Oh,
it's
me
an
too.
active process, of course.
Yeah.
And I wonder, why is it in psychotherapy or that you're taking your kid to a therapist, every other thing that you take your kid to, they're supposed to practice between, right? If you want them to learn the piano, the piano teacher doesn't say no touching the piano between sessions, right? The physical therapist doesn't say no doing your exercises between sessions. The occupational therapist says don't talk about this or don't do anything. But we as therapists say, well, we're not going to talk about this,
Right.
or we're not going to do anything, right? It just is absolutely contrary to what we know is that with selective mutism, with social anxiety, with OCD, with depression, action counts. That
Absolutely.
we learn, the brain learns experientially. So,
yes. And if you think about it, and you know this, and I explain this to families all the time, anxiety is about being out of control. You're out of control. And a big part of the treatment, like for me, social communication anxiety treatment, it's a very CBT based approach. It's all about putting control back in their life. and using the exercises, the goal charts, the game charts for young children, the parenting goals. It's to help them unlearn their conditioned behaviors and accountability. And it creates inner control because you begin, and I know you talk about this because I was just listening to this on one of your podcasts, and it said about you change your focus.
Mm-hmm.
And so you're focusing on the games for the little guys and the goals for the older kids, and the parents are unlearning their conditioned ways.
Mm-hmm.
And yes, it's about accountability. So I struggle because when I see families that have often been from person to person, if they're traveling to PA from California or Europe or wherever, they've exhausted usually their local resources. And one thing that is almost, Lynn, universally missing is the accountability piece, knowing what to do, when to do it, how to do it, and where. And really helping demystify this process. And I love how you talk about that with kind of the demystifying this, that it's okay to be anxious. It's okay to be worried. You can name your worry. Talk to me about that, because this relates to parents and kids.
Yeah. So one of the things, it's interesting that you bring up this notion of control, because one of the things that is inherent in anxiety disorders is there's a very low tolerance for uncertainty, a very low tolerance for discomfort. So what I often see is that accommodations or patterns or, practices, whatever you want to call them, families are doing these things in an effort to get rid of uncertainty.
Yep.
So there's often over planning and over accommodating and over reassuring, rather than saying to kids, it's really okay that when you step into a new situation that you feel uncomfortable, you're not supposed to know how everything is going to go. So there's this interesting balance between planning and then being flexible enough to manage when things don't go as planned. So it's sort of the analogy I use is that I fly a lot, right? So I'm going to the airport. When I go and do a talk, or when I'm going to the airport, there's a lot of planning that goes into that. I can't just show up to the airport when I feel like it and be like, hey, is anybody going to Vancouver? So there's planning, but then things go wrong, or the flight is delayed. Or the other day I was waiting at the airport and I was waiting for my black Toyota Highlander Uber and the two first letters on the license plate were DV, and then there were some numbers. So I wait. A black Toyota Highlander pulls up. The first two letters on the license plate are DV. I get in. And about 2 minutes into the ride, the phone starts ringing. My phone starts ringing and his phone starts ringing. Well, there was another black Highlander, Toyota Highlander,
goodness,
with the license plate DV. I got in the wrong one.
Wow.
Now, right, so we have to solve this problem. These things happen all the time. Now, what anxiety wants to do is make that into an emergency. But it really is a problem to solve. There are things that we can do that make things easier and harder. And we want kids to understand that as you step into new situations, socially, right? Social anxiety, SM, we're stepping into new situations. How do we tolerate the fact that we can't completely control what other people think, what they're going to say, how they're going to react? We sometimes can't control what we say. Sometimes we stick our foot in our mouth. Sometimes we're talking and a little spit comes out of our mouth and lands on the other person's nose. How do we increase a tolerance for not knowing exactly what's going to happen? We still plan, but we can't know for sure.
And I think what makes it so hard, at least in this population, is that not only are children anxious, right? They have that bias, that inhibited temperament. And parents often have it as well. There's that large percentage of, parental anxiety from the genetic and learned components, but they have the social communication challenges.
Yes.
So they may just go out, but it's where are they in terms of their comfort and communication? So you're not just dealing with the anxieties of what's going to happen when, but it's their communication on top of that.
Right.
So it's a very challenging situation. Let's talk a little about like how you talk to your clients about managing their own anxiety, which is big, because I remember listening to something about a grandmother. You were dealing with a parent and a child, and you talked to the grandmother and she was very anxious and she was telling you what to do, how to do it. And you saw that like almost like that mother that was projecting that to her daughter.
Yeah.
So it was 3 generations
Yeah.
starting.
Mm-hmm.
Right. And
Yeah.
you, like you said,
Yep.
you have to see these dynamics. And you and I, with 30 plus years, right? 34 going, we've seen so much of our intuition. We can see it, right? We
Right.
feel it.
Right. Right.
And it's about
Within a minute.
Exactly. And
Mm-hmm.
that's what people get when they go to us. They get
Mm-hmm.
years of experience to know and understand rather quickly, frankly.
Mm-hmm. Yeah.
And so with that, when you're talking to parents about these difficult topics and you see their own anxiety, but yet they came to you to cure their kid, how do you talk to the parents about this?
Well, first of all, very often I kick the kids out.
Yeah,
Right. Although
of course.
I don't mind having the kids there. And certainly what's interesting, and you may notice this too, is that if you're talking to parents about their child and you want the child to hear what you're saying, they
Yes.
are very interested, right? So sometimes the
Yes.
kid will say, I'm not going to sit in here and listen to this. And I go, well, you can leave if you want. And they're like, I'm leaving. And I'm like, okay, go ahead. And they're like, I mean it right now. Yeah, yeah, right. So I want to normalize it for parents.
Exactly.
I ask when I have a family in front of me, I will ask the kids, who is the anxious parent, do you think? Who worries more? Inevitably, I mean, they know within a second, right? They're like, they point at one. And then I'll say, and who do you think taught your mom or dad to be anxious? And the kids know that too.
Yep.
They'll say, oh my gosh, grandma is such a worrier, or grandpa really freaks out. So as soon as we begin to just talk about the generational patterns in a family, and as soon as we begin to normalize it, as soon as I begin to say, yeah, this is exactly what I see all the time, and then I really focus on skills.
Yep.
Because I firmly believe that nobody sets out to say, oh, let's see, how can I make my kid anxious? Let me see, how can I do it? It's not that hard, honestly, but they're like, how can I do it? They're doing what they know. They're doing what they believe is helpful. They're doing often what feels good. I'm sure you see that a lot too, because they're trying to be supportive and caring and loving. So my first step is to normalize it and to say, look, your heart is in the right place. You're not doing this on purpose, but there are certain skills that you don't have and that your child doesn't have. So we're going to talk about skills. We're going to talk about the ability to. And I'm sure you have your list of skills that are right there in front of you. And I have my list of skills that are right there in front of me. There's something with parents called parental experiential avoidance. And that's just a fancy research term that means the difficulty tolerating distress, either in your own distress or in your children. So I want parents to be able to, I tell them this, I go, look, there's this thing called parental experiential avoidance. And they go, oh gosh, I've never heard of that. I go, yeah, it's very, very common. And then I explained it to them and they sort of sheepishly say, oh yeah, that sounds like me. Or they say, oh my God, my husband, terrible with that, right? If the kid cries, he jumps in. And so I have to give parents a roadmap, a little guidebook that says, when you do this, your child is going to say this or do this, then you're going to do this. You got to hang in there because we're trying to get to the end point. And I draw boxes a lot, like as if it's a comic book, right? So first this happens, then this happens, then this happens, then this happens, and then this happens, right? That's how it goes in your family all the time. So now let's draw it again. First this happens, then this happens. Let's change this box right here. Instead of you jumping in and removing the child, instead of you yelling at everybody else for scaring your child, instead of you trying to rearrange the world so that your child feels certain and comfortable, let's talk about what we're going to do instead. And that's when we talk about externalizing the worry. I want parents to pull the worry out and give it a name too. So say I've got a really anxious mom and I say, all right, let's pull your worry out. What shall we name it? And, she says, oh, okay, we'll name it Patricia. So I say to the kids, okay, so when Patricia shows up, how do you know Patricia is in the house? Whoop, whoop. How do we know Patricia's in the house? And they'll say, oh, mom does this, or this is what she says, or her face gets that look, or she starts screaming at us, or whatever. So, okay, so the next time Patricia shows up, I want you guys to say to your mom, Mom, Seems like Patricia's kind of taken over the activity. And then I say to the mom, your first response is you're going to be super defensive. You're going to say, oh, no, it's not. It's, well, I'm just worried about your safety. And, oh, I'm a terrible mother, blah, blah, blah. No, right? That's your first response. But I want you to look at them and say, thank you so much for pointing that out, right? And everybody has a good laugh, but it gives them a series of steps to take so that the pattern goes differently. So we don't end up in the same place. And the same place is always the same, right?
Yeah.
Somebody's freaking out, somebody's melting down, and now we're going to avoid. Right.
Yeah, no, I hear what you're saying. And I always say it's like I am your Waze or your Apple Maps, and kind of like go, and that helps them because they realize, whoa, there are pathways to get to accomplish what we need to accomplish.
That's right.
And unlearn these pathways. And they love that. They love to know there's a roadmap. One thing I see often is, and you talk about this a lot in your work, is parents that talk at their children. You shouldn't be anxious. You should do this. You should talk to your friends, because if you talk to them, they're going to want to come over. You need to do this. And I tell families, I have all these like words, 365 days of SM. I have all these terms. There's millions of them. I can't do 365 because I have so many.
Yeah.
But my point is, I have these terms I interject into my treatment. And I feel as if like this kind of demystification for families is really, I call it acknowledgement and assessment, to be able to acknowledge there's a challenge and then to be able to assess it. I talk about the Apple Maps. I talk about the maps. And I feel as if you need to remove you need to and you should. Like stop shoulding and need to. Because
Stop shitting on yourself.
Yes, exactly. Yeah. Yes. So but the kids feel so shamed too.
Yeah.
And so a lot of this is their anxiety. They want to fix it yesterday. And they end up shoulding and needing to, and the children feel shame. They become more avoidant and they are resistant. And so I know you see this because I see this, and I have to talk to the families about removing these words. And one of the things you talk a lot about is validating, like really just saying, it's okay. I know this is hard, and connecting to your child. And let's together work through this.
My two favorite words, of course. Of course you feel worried about that. And I also say all the time, I don't have my mug near me, but I also say all the time, talk 85% less, right? Because you're in the selective mutism business. And a lot of people, it's interesting because I'm sure you hear this all the time because I hear it. They'll say, well, she talks like crazy at home, so she obviously can't have this. Right? No, that's why it's called selective mutism.
Yes.
And so families, even with selective mutism, the parents talk too much.
Yes.
Right? They talk too much. So talk 85% less and give room and space for your kids to figure out what they're going to do next. And with SM, it's the same way, is that they have a hard time just stepping back and letting their child figure it out, letting their child struggle a little bit, a really difficult time. Somebody asks their child a question and the child is quiet and they want to jump in right away and fix it. So it's all about giving parents the instruction more than permission, because it's not like they want to, right? You got to give them the instruction to let things unfold. Let them learn with support and love and encouragement and validation. But we've got to let them have the experience, because that's how the brain learns.
Yep. Exposures. And then training parents. You talked about, kind of letting the children and then the kind of be, and then the parents jumping in. And that's what happens. They'll talk for their children, and the children learn not to. And an example I give is that children don't often know how to even navigate a social situation because they've been the passenger in the car.
Right.
Parents are talking, their outgoing siblings are talking, and they're just there. So it's not even about talking. They're not even engaging, so many of my clients.
Yes, I love that. I love that analogy, because when you're the passenger in the car, you're not paying attention to where the next turn is. You're not paying attention, right? You're just sort of in your own head, kind of doing what you're doing, not really paying attention or engaging.
And a lot of this is the parents' anxiety, because they're trying to fix it. And
of course.
Right. And so what advice would you give to a parent like that for their own anxiety of having to fix it right away?
So what we know is the things that feel good in the moment are the things that actually make the problem worse. I call it doing the disorder. So
Mm,
some of the things, like when you're working for the anxiety disorder, you're doing the disorder.
I
So
love
some of
that
the things
term, doing the anxiety disorder. We
yep.
need to put some music to that.
Yeah, you can if you want.
Yeah.
So some examples of that are reassurance. Like everything's going to be fine. Talking too much. I'm going to give you as much information as possible. So I see a lot of plans in schools that says that they'll say something like, this child has difficulty with transitions, so we want to make sure they know exactly what's going to happen all the time. Who loves that? The anxiety disorder. The anxiety disorder is like, oh, thank you so much. We hate uncertainty, so we need to know exactly what's going to happen. Like you said, stepping in and speaking for your child, making sure that the environment doesn't have any triggers. So I talk about this a lot, but a client I had whose daughter was afraid of dogs. And so she emailed all the parents on her daughter's soccer team and said, please, nobody bring your dogs to soccer practice. Well, people like to bring their dogs to soccer practice. You let your dog run around. So stepping in and putting in accommodations in the absence of skill building. So when we're talking about anxiety, what I see very often is parents will put things in place, schools will put things in place that are designed to eliminate discomfort or create certainty in the absence of skill building. Because sometimes we have to start where the kid is. If they don't know how to do something, right?
Yep.
They need those building blocks to get there.
Yes.
But what I see is accommodations put in place forevermore.
Right. No interventions.
No interventions, accommodations in the absence of skill
Yep.
building. So you might see this a lot. I certainly see this. You have a child who has difficulty giving a presentation, right? Standard social anxiety, can't stand up in front of the class, give a presentation. So they put in an accommodation that says, Caitlin, never, forevermore, will
Exactly.
ever have to give a presentation. Right. And the anxiety says, you guys are the best.
I love you.
Yeah. Thank you so much for helping us avoid.
Right. Exactly.
Right. Right.
I'm
But
in
it
my
happens
perfect
all the
little
time.
cushy little box and
Mm-hmm.
bubble of life. And
Yeah.
that's where I tell families, it's like if you go from the first floor to the second floor, you don't run up the steps. Our
Mm-hmm.
kids need to chop them up. First step
Mm-hmm.
gets chopped up, second step,
Mm-hmm.
and it's steps. So if you can't present, but maybe your first step is to meet with a buddy and a teacher.
Mm-hmm.
And so
Right.
you'll do either write and read, or maybe even just show.
Mm-hmm.
Wherever they are on the social communication bridge, you've got to have a baseline to start. And
Mm-hmm.
then for me, I use a lot with feelings, like they rate their feelings between 0 and 5 or 0 and 3, of how they feel to be able to accomplish some of these goals
Mm-hmm.
along the way. So yes, there's no such thing as accommodations without interventions, as you're keeping them flat and they're never going to grow.
Right. The thing too that I think is so, which you are alluding to, which I think is so important when we're in this anxiety realm, is connection.
Oh, yes.
Because what anxiety does and what SM does, right, is it makes kids' worlds smaller.
Very small.
And unfortunately, when we have an anxious kid and we don't do anything about it, the likelihood of them being a depressed teenager and a depressed young adult is very high. It's one of the top predictors, actually. Untreated anxiety, top predictor of developing depression. And one of the main reasons for that is because the world gets smaller, and all of the things that the parents could do when the child was little. So hang out at the birthday party, or go to the swimming lesson, or become a coach on the little league team. All of those things that they can do when they were little become far less possible as the child gets older.
Exactly.
And so now that instead of doing the thing, then the kid just says, I'm out.
And kids are less accepting as they get older.
That's right. That's exactly right.
Right? As parents, we set up the play dates, the kids, we do all that. It's about our friends and their kids. But all of a sudden you hit the middle school age and it's not like that anymore.
Correct.
And our kids are wise enough to think, wait, I'm not really friendly with that person.
Right.
I can't get together with them. So then you rely on the school to set up these, social groups, those clubs, the activities, parent group in the different classes. There's a lot that goes on in the background with, trying to manage, but build skills at the same time.
Mm-hmm.
So we
Yeah.
have to respect their anxiety. That's why I use that 0 to 3 or 0 to 5. So the children are active participants. They acknowledge their difficulty. They can assess it. And
Mm-hmm.
together we work. It's not,
Right.
you need to do that. I hear this all the time. I need my child to speak. What are you going to do to get them to
Right.
speak? I need them to
Right.
speak yesterday. It's like, whoa, calm down. Like, I'm anxious just listening to this.
Right.
We need to step back and really
Mm-hmm.
understand, and also work with you to learn, to unlearn your behaviors that may be reinforcing some of this.
Mm-hmm. Right. And it's easy to reinforce,
Oh, so easy.
right? It's so easy
It's
to
what we
reinforce.
know.
Right. And again, they're not doing it on purpose. But I think, one of the things when I talk to schools, when I'm in schools, and I say this often, I say, look, my job in a lot of ways is easier than your job because I can require parent participation. Because a lot of teachers will say, well, this all sounds well and good, but how do I get the parent to do it? So I can, if a parent just out and out refuses to participate, I could just be like, well, I'm not going to work with you because that's not going to work. But I think the thing that is really compelling for parents to hear is that if you continue to reinforce, even if you're doing it for all the right reasons, if you continue to support the anxiety, if you continue to do the disorder, this has a very predictable course. And I don't think you want to predict that for your child. So then when we say to parents, there are things we can do differently, and we get them, we want parents to feel confident that they can do these things, right? That's why they need our support in doing these things. Yeah.
Yes, for sure. What are some tips you're giving these parents? Because a lot of times they don't know what they don't know.
Mm-hmm.
They don't realize it. It's like the family that was sitting in front of me a couple weeks ago, and the child had to go to the dentist. And I've heard you talk about the dentist, and the mother, it's the first time the child's going to the dentist because they avoided it for the first 4 years
Mm-hmm.
of the child's life.
Mm-hmm.
So the mother sits in this session and she turns to me, and the child's next to her and says, we have to go to the dentist. I've been telling my daughter she has to get her teeth cleaned. And I'm just so worried.
Mm-hmm.
I'm worried that because she's sensitive, and I know when the dentist opens her mouth, she's going to freak out. And the child is looking at her mother in terrorized.
Yeah, right,
And I'm like,
right.
stop.
Yeah, 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 yeah. So I call that safety chatter. So one of the things that we really want to work on immediately with parents is, for one, being very aware of what they're saying in front of their child.
Yes.
And
who
how
they're talking to.
Who they're talking to, right. And pull out. So we pull it out. We've got Patricia, remember, and to say, like, look, Patricia loves to catastrophize. Patricia loves to talk about what could go wrong. Patricia loves to anticipate all the horrible things. Patricia loves to just talk and remind the safety chatter. Oh, be careful. Oh, watch out. Oh. Catastrophic parents, one of the things they do is they'll give a good, valid safety instruction. So when you're, what we say, when you're walking your bike, make sure that you pay attention, blah, blah. And then a catastrophic parent will say, and let me tell you why. And then tell this horrible story about the possible outcome.
Yes.
They don't realize that they're saying to their child, let's just watch this movie about the bad things that will happen in life.
Right.
So anxious parents talk a lot about bad things. They project their worry onto their child. I had the same situation with a relative when I was trying to teach her how to swim. She was very afraid of the water. She was little. She's big now. And the mother was standing there saying, look, it is so important that you learn how to swim. Because if you don't learn how to swim and then you jump in the water, you could drown. And that's very, very scary to me that you don't know how to swim. And that's saying, like, so get in the water. So really making sure that parents are paying attention to their safety chatter. The other thing with anxious parents is that they mistake worry for love.
Yeah.
Right? If I don't worry about my child, if I don't talk to my child about all these things that I worry about, it means that I don't love them. Sometimes it even gets a little superstitious, right? It's when I stop worrying that the bad thing happens. We really want to be very clear with parents that worrying is not problem solving, that catastrophic thinking is not problem solving. You want to teach your kids, how do I manage when things don't go the way that I expect? That's one of the homework assignments I give to families all the time. At the dinner table, I want you all to go around the dinner table and say, what was the unexpected thing that happened to you today and how did you manage it? And I
Yeah,
want
demystifying.
right. And I want the grown-ups to verbalize this because the kids don't see all the things that the grown-ups are handling. So anxious parents need a lot of education and a lot of support about all the ways that they convey to their kids that the world is a dangerous place. That's one of the things we really want to pay attention to.
Yeah, no, for sure. And I think one of the things that it's a busy, busy, crazy world, right?
Mm-hmm.
There's a million things happening. A million things in the last couple years have just shocked us all.
Mm-hmm.
There's a lot going on. And so it's a busy world and our parents are juggling a million things. It's almost like the more activities your kid is in, the better mom I am.
Mm-hmm.
And so they're juggling, they're stressed. Some parents are working. They're to have 3 or 4 kids. Their life isn't crazy, right?
Mm-hmm.
And so with that in mind, it's teaching parents some self-care to manage their own anxiety.
Right.
I'm sure you talk about that because they're so focused on trying to control everything. Because
Mm-hmm.
I listen, I'm a mom. My children are all adults, but I had 4 kids in 3.5 years.
Oh my God.
The self-care part of managing anxiety, it's teaching them to know so much of what you're talking about. Do you tell me about how you talk to your families about the need for self-care and that sort of thing?
Yeah. So there's a whole chapter in the anxiety audit about this busyness culture that we have.
Yes.
And how so much of the time we see that as a sign of status, right? The busier we are. Like when you run into your friend and you're like, oh my gosh, how are the kids? Oh my God, life is so crazy. Oh, my life is crazy too, right? We never say, oh no, we're coasting, right? It's pretty cool. I'm not doing too much. We never say that. We do that humble brag about, oh my gosh, so stressed, so crazy. It really is kind of a badge of honor. The distinction that I make for adults, the difference between self-care and self-medication. So the way I see self-care is that it is a consistent practice of the things you do that you know are good for your mood in particular, because mood management.
Yes.
So I will ask people, I ask this to teenagers a lot, but adults as well. I want you to think about 3 categories. One category is, what are the things you know that make your mood worse, that make you feel lousy, right? Your operating system. I know the things, you know the things. What are the things that you do that make you that make your mood better, right? Is it going for a walk? Is it getting in the sunshine? Is it exercising? Is it getting enough sleep? Is it blah, 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 blah. And then the third category, which is super important, particularly for teenagers, is what are the things you do that make you feel better in the moment, but bad long-term plan? Because I
Interesting.
think
like
a lot of the self-care language,
Yeah.
right? When I see, like I've had it with the mommy wine culture, looking at the statistics about women and alcoholism and et
Oh my
cetera,
goodness.
right? But there's a lot of sort of like, oh, self-care for me is just, having a margarita at the end of the day. Bad long-term plan. So when I look at self-care versus self-medication, self-care is consistent, happens over time, we can bank on it, and you never feel regret after you participate in some sort of self-care. You never say, oh, I can't believe I went for a walk with my friend, right? Oh, I can't believe I got a good night's sleep. What was I thinking? But with
Can't believe I had a date night with my
yeah,
partner.
right.
I
Why?
can't
Yeah,
believe that I
right,
slept an extra hour on
right,
Saturday.
right. Why did I go to yoga, for God's sakes, right? But with self-medication, we get that regret. Oh God, why did I stay up so late binging on that Netflix show? Or, oh, I shouldn't have eaten all those Oreos. Or, you know what, I really just wanted to get a little break and I went out and I spent too much money and now I have to go back and return all those clothes I bought. So self-medication comes with regret. Self-care is really you learning about you and committing to doing things again in a consistent basis. A bath once a month might feel nice, a bubble bath, but that's not really self-care. That's kind of giving yourself a treat. But making sure that 3 times a week you go for a walk outside, or making sure that every morning you fill in the blank. That's what we talk about with self-care. Mood management, anxiety management, depression management, however we're looking at it, is really about small things that add up consistently over time. And I think one of the messages that I really want parents to hear as they're dealing with all of this in our crazy lives is that small things do matter. So you don't have to overhaul your whole life to make a difference. If you just started, if the one thing you did was to pull out your worry, own it, give it a name, and tell your parents to call you out on, tell your kids to call you out on it, that would make a huge difference in your interactions.
And this also leads to the thought of talk about your worries to your child. There's a lot of parents that don't want to share, that they have this like pedestal. I don't worry. I want, it's not good to worry. It's not good to feel anxious. And they don't want their children to know. And that scares their child because they feel very alone. And so the parents that share their experiences and say, that was scary for me, and kind of relate to them, that opens the child up to be able to express themselves more instead of pull away.
Right. With the one caveat, is that if it's safety chatter, and if the parent is saying, oh, that was so terrifying for me, that was awful, I can't believe, right? So then they're just showing their kids how to worry. But you might say, oh, I know, I had to go to the dentist, and I never had a root canal before. And I'll tell you, I was a little nervous before I went in.
Exactly.
Yep. And I didn't like it. I didn't enjoy having a root canal, but it was really the good decision for me to make because I got to take care of my tooth or whatever it might be. You come home from work and they, this is again at the dinner table, right? How was your day? Oh, it was pretty good, but I had to have this conversation with my coworker and it was a little uncomfortable because there were some things she was doing that were sort of making my job harder. And I was nervous when I went in, my heart was pounding, my tummy felt a little, butterfly. But it was important for me to take that action. So we want to give our kids kind of the sequence of, I had to do this thing, I felt nervous, I problem solved, and I was able to make some progress. We want them to see the through, right? Not just stop at the worry.
Absolutely.
Yep. Yeah. Modeling is so important. It is so important.
It's so important. It's such a big part of just this whole process of modeling. Your children pick up, and for kids with selective mutism, the majority are very sensory sensitive. They're very emotionally dysregulated at times because they have the sensory sensitivities. So they're more perceptive, they're more aware. And with that inhibited temperament, more likeliness to not want to engage, it's like it's magnified for so many. And because of that genetic component, it's the parents are feeling it too. So the kids are modeling their parents that don't want to go out to a party or they don't want to go out and do things. And that's one of the challenges is if you've got to go out and do. And so working with those parents that have the anxiety themselves, the social anxiety piece is a whole challenge in itself.
Yeah. Yeah. I really can't, I really can't get very far if I'm dealing with an anxious family and there's an anxious parent. I will tell you, it is very rare for a very anxious child to come into my office and have two really chill, laid back parents, right? That is not the way it goes.
No, it does not.
But it is very, very hard for me to work with a family if the parents won't own their own stuff, right? If a parent is in denial about it, if a parent isn't willing to model, if a parent isn't able to say, oh, and that doesn't happen. It's much more frequent that a parent says, oh, I totally get it. I felt the same way when I was a kid, et cetera, et cetera. But when parents are refusing to acknowledge
you're absolutely right. I was just telling my office manager this, a family that had come had been all over for treatment. Whoever they saw were not helping them understand their own fears and anxiety. And as soon as we started to talk about it and the parent changed the way she responded, how she reacted, the child just modeled that. And it was almost incredible, the change that they made.
Right.
Versus the parent that comes in, cure my child and not take any responsibility. And it's impossible to work with a family that isn't willing to take your expertise to change and change their ways.
Right. And I'm sure you see this all the time because I certainly see it, is that if you've got a parent who's anxious about their child's anxiety, be it selective mutism or social anxiety, and they start saying, oh God, you've got to do this. You guys, that just increases the pressure
Oh,
on the kid. So if you want to shut down a kid with some social issues,
yeah,
put social pressure on them, right?
exactly.
It's sort of the same way where we tell kids, I go into schools and I'm sure you say the same thing, is that if we're working with a kid with SM and they use their voice, don't throw them a parade,
No,
right? That's like, they don't want everybody to go, oh my gosh, Hannah just talked, right?
right.
So it's a lot of coaching and a lot of giving concrete information to parents who
This
again
was
are
so fun. I
trying.
feel like we could have spent a week
We
or
could have
two.
spent a week. Yeah.
This was great. Any last minute advice to the parents, the listeners, the majority are parents that listen? Any advice to them about how to begin this process of handling their worries and so forth?
Yeah. So I think the most important thing is that you really, avoidance begets avoidance. And even though, so the reason avoidance is so popular, so to speak, is that it works like a charm. So if you are worried about something, or if your child is worried about something and you avoid it, right? Boy, things get better pretty quickly. But the more you avoid, particularly with school, we're seeing a lot of increase in school refusal and school
Yes, a
avoidance.
lot.
And the more that you put those accommodations in place, the more that you support a child not engaging in their world, the worse the problem is going to get. So it feels counterintuitive. It's super hard. You're going to drop your kid off at school. It's okay if you cry all the way home. That's okay. But we really want to make sure that we are focusing on taking action that steps kids into connection rather than supporting anxiety's really desire to shut your kid down. And that's what it does.
Definitely. I couldn't have said it any better. And it's really work with your treatment professional, find a good treatment professional that can help you navigate this because they don't know. Like you don't know. I know as a parent, you don't know, right?
Yeah.
So,
Yeah.
so work with somebody that understands and gets it and can be compassionate to you with your own fears and worries. And it's a roadmap, but learning the skills, it's beautiful when you see that evolution and that metamorphosis, frankly.
That's right. And don't be afraid to ask, if you're looking for a therapist, to ask what
Right.
their training is, what their expertise is, because I'm sure you've had this experience. Therapists can do it wrong.
Yes.
And you got to go to somebody who knows what they're doing rather than just going to somebody who's just nice.
Right.
Right?
True. And also, if it doesn't feel right, it's not right.
Right.
Go with your gut. Like in your gut, if somebody's telling you something and you're like, whoa, that doesn't feel right. It's not like you're dealing with their anxiety that's not feeling it's like that just doesn't feel right. It's not right.
Mm-hmm. Yeah.
It shouldn't feel that hard. Your therapist should be validating you and helping you navigate, not it should feel right, right?
Yeah. Well, and they should also be telling you what to do.
Yes,
Right.
for sure.
And if you go to somebody, people say this all the time. Well, we've gone for 10 sessions and we know that we're just building rapport.
Yeah.
Right? No. You know what builds rapport? Telling parents what to do. That builds rapport.
Absolutely. And I tell them all the time, I said, look, my families will tell me all the time, you say it the way it is, Dr.
That's right.
E. And I do. And I say it in a way that's productive.
That's right.
And they love that. They want
Right.
to be told what to do and they
Right.
want to be able to have the skills and they thank you for it.
That's right. That's right.
Right?
Yep.
This has been wonderful.
Oh, thank you for having me. I so appreciate it.
Oh, absolutely. And I continue to recommend you and your books, The Anxiety Audit and The Anxious Kids, Anxious Parents, and your website and Fluxterclux. I love it. It's awesome. And you're an amazing speaker. So thank you.
Oh, well, thanks for all of the work that you're doing with selective mutism because it's something that's really misunderstood and mistreated. And so we need the expertise to really help parents figure out what they need to do.
Thanks so much, Lynn.
You're welcome.
Bye.
Bye.
Bye.